We've got a clinical case, my beloveds. A 58-year-old man presents with a painful lump in his right groin that appears suddenly after lifting a heavy object. He reports nausea and vomiting. On examination, there is a tender, irreducible swelling in the right inguinal region with overlying skin erythema. The lump doesn't reduce with gentle pressure, and bowel sounds are absent over the swelling. What is the most likely diagnosis? Reducible indirect inguinal hernia, incarcerated femoral hernia, strangulated inguinal hernia, that is a strangulated inguinal hernia, and the direct inguinal hernia. No, correct option is strangulated inguinal hernia. So these patients' presentation of a painful, irreducible groin lump with systemic symptoms, nausea, vomiting, and skin erythema is typical of strangulated inguinal hernia, where the herniated bowel loop loses its blood supply. So a surgical emergency. A reducible hernia would be soft and painless, while the direct inguinal hernia occurs medially and is less likely to strangulate. A femoral hernia are more common in females and occurs below the inguinal ligament. Okay? Not okay. Okay. So why reducible indirect inguinal hernia is incorrect? A reducible hernia means the herniated contents can be pushed back, okay, into the abdominal cavity easily without pain or systemic symptoms. In this case, the lump is painful, irreducible, and associated with vomiting and erythema, indicating compromised blood flow. Not a simple reducible hernia. Reducible hernias are soft, non-tender, and often increases with coughing or straining, but reduces spontaneously when lying down. Next, incorrect femoral hernia. Of course, incorrect. An incarcerated or obstructed hernia means the bowel is trapped but not yet ischemic. This patient's symptoms: pain, redness, nausea, vomiting, point to strangulation where ischemia has already occurred. Additionally, the location of the lump is important. It's the right inguinal region above the inguinal ligament. A femoral hernia would be below the inguinal ligament and is more common in women, not in 58-year-old men. And the direct inguinal hernia. Direct inguinal hernia protrudes through the posterior wall of the inguinal canal, so-called Hasselbalch's triangle, and is usually acquired, broad-based, and less likely to strangulate because it has a wide neck. So these hernias are often painless, chronic, and easily reducible. In contrast, so the patient's acute pain, tenderness, and systemic symptoms point to strangulation, which is far more common in indirect inguinal hernias, especially with a narrow neck. So, correct option is what? Of course, strangulated inguinal hernia. Why it's correct? Acute pain, irreducibility, nausea, vomiting, skin erythema, vascular compromise, strangulation. The inguinal location, confirm it's not femoral, of course. Strangulated hernias are surgical emergencies requiring immediate intervention to prevent necrosis and perforation of the trapped bowel. That's it. Stay blessed. Okay, good.